everyone! Welcome to our comprehensive guide on understanding and managing acne. Today we're breaking down acne, something almost everyone faces at some point in their lives. It's a common concern that affects people of all ages and backgrounds, and understanding it is the first step towards effective management. Acne is a skin condition, a very common one, involving your hair follicles and oil glands, specifically the sebaceous glands. These glands are found all over your body, but are most concentrated on the face, neck, chest, and back, which are also the most common areas for acne to appear. These glands produce sebum, an oily substance, to keep skin healthy and moisturized, preventing it from drying out and cracking. Sebum plays a vital role in maintaining the skin's natural barrier. But sometimes, things go wrong, and the delicate balance of our skin is disrupted, leading to breakouts, those unwelcome blemishes that can pop up at the most inconvenient times. While acne is common in teenagers, often linked to hormonal changes during puberty, it can affect anyone, adults included, and it's more prevalent than many people realize. Adult acne can be particularly frustrating due to hormones, stress, or medications. Fluctuations in hormone levels, high stress levels, and certain medications can all trigger or worsen acne in adults. It doesn't matter your gender or background. Acne doesn't discriminate. Acne is universal, affecting people from all corners of the globe, regardless of ethnicity or skin type. The main causes? Let's break down the primary factors that contribute to acne development. Excess oil or sebum production. Clogged pores caused by a buildup of dead skin cells and oil. Bacteria, specifically Propionibacterium acnes, P. acnes, which naturally lives on the skin. And inflammation, the body's response to the presence of bacteria and clogged pores. It's important to note that acne is not primarily caused by dirty skin or junk food, although a healthy lifestyle can certainly support overall skin health. When pores get blocked with dead skin cells and sebum, bacteria thrive in this environment, leading to infection and inflammation, causing redness and swelling, the telltale signs of an acne breakout. Acne isn't just cosmetic. It's more than just a superficial issue. It can impact self-esteem and mental health, leading to feelings of anxiety, depression, and social isolation. By understanding the different types of acne, from blackheads and whiteheads to more severe forms like cysts and nodules, you can take control and find the right care for your skin, leading to clearer, healthier skin and improved confidence. Let's dive in, explore the science behind acne, and debunk some common myths, and empower you to manage your skin with confidence, so you can feel good about yourself and put your best face forward. Let's start with non-inflammatory acne whiteheads and blackheads. These are simply clogged pores, no redness or pain, just bumps. It all begins when excess oil and dead skin cells plug a pore, forming a comedo. If you catch these early, you can often prevent more severe breakouts. Non-inflammatory acne is most common in oily areas like the T-zone, but can appear anywhere. They don't hurt, but can make skin look bumpy or uneven. Recognizing these early is your first defense. Gentle exfoliation and products with ingredients like salicylic acid can help clear clogged pores. Addressing these bumps early keeps your skin smoother and healthier. Remember, these are the starting point of the acne cycle. Tackle them before they escalate. Now let's zoom in on whiteheads, those tiny blemishes that often appear on our skin. We're going to take a much closer look at what they are, how they form, and most importantly, what you can do about them. Understanding whiteheads is the first step to achieving clearer, healthier skin. These are closed comedones. The term comedone refers to a blocked hair follicle, and when that follicle is closed, we call it a whitehead. They're a very common skin concern, and understanding their nature is key to addressing them effectively. Here, a plug of oil, also known as sebum, and dead skin cells forms beneath the skin. This mixture builds up within the pore, creating the foundation for a whitehead to develop. It's a natural process, but sometimes it can lead to these unwanted blemishes, effectively sealing the pore. This closure is what differentiates a whitehead from a blackhead. Because the pore is closed, the contents are not exposed to air, preventing oxidation. This creates a small, flesh-colored or whitish bump on the skin's surface. They can be subtle, sometimes barely noticeable, but they're there, a sign of a blocked pore beneath. Because the pore is closed and not exposed to the air, the trapped contents remain protected. This is why they appear as white or flesh-colored bumps, rather than the darkened appearance of blackheads. The contents stay white or yellowish in appearance. This is due to the lack of oxidation, which would otherwise darken the trapped sebum and dead skin cells. Whiteheads are usually small, not red, and typically not painful to the touch. This is because they are generally non-inflamed, unlike other types of acne that can cause significant redness and discomfort. They're incredibly common on the face, affecting people of all ages and skin types. They can appear as isolated spots or in clusters, depending on individual skin conditions, especially the forehead, chin, and jawline areas. These zones tend to produce more oil, making them more prone to clogged pores and the formation of whiteheads, but can appear elsewhere on the body where there are hair follicles and oil glands. The back and chest are also common areas for whiteheads to develop. Squeezing them can push bacteria and debris deeper into the skin. This action can exacerbate the problem, leading to inflammation and potentially scarring, ultimately causing bigger problems, such as inflammation, redness, and even infection. It's best to resist the urge to pick or squeeze at whiteheads. Instead, when examining your skin, look for small, raised bumps that are consistent in color with your skin tone, or slightly whitish, without redness or a dark center. This helps differentiate them from other types of blemishes, like pimples or blackheads. So, what's the best approach to dealing with these pesky whiteheads? It all starts with a consistent and effective skincare routine. Consistent skincare with ingredients like salicylic acid is key. Salicylic acid is a beta-hydroxy acid, BHA, that works by exfoliating the skin and penetrating pores to dissolve the oil and dead skin cells, to dissolve the plug that's causing the whitehead. This helps to unclog pores and prevent future breakouts. Gentle care helps these bumps clear naturally over time. Avoid harsh scrubs or excessive washing, as these can irritate the skin and worsen the problem. Above all, avoid picking or squeezing at whiteheads. This is crucial to prevent inflammation and potential scarring. Instead, let your routine do the work, gently exfoliating and unclogging pores over time. Consistency is key to seeing results. That's the secret to effectively managing whiteheads and achieving clearer, healthier skin. Remember, patience and consistency are your best allies in the fight against these common blemishes. Next, let's talk about blackheads. Open comedones. Like whiteheads, they start as clogged pores, but the top stays open. The plug is exposed to air, causing oxidation, just like a cut apple turning brown. The dark color isn't dirt, it's oxidized oil and skin cells. Blackheads are most common on the nose, chin, and forehead. They're flat or slightly raised, not painful and not red. Squeezing can damage skin and cause scarring. Instead, use products with retinoids or salicylic acid to keep pores clear. Remember, blackheads are about chemistry, not cleanliness. Now we move to inflammatory acne, starting with papules. Papules begin as clogged pores, but when the follicle wall breaks, the immune system reacts. This causes redness, swelling, and tenderness. Papules are solid red bumps, no visible pus, just inflammation. They're often sensitive and can appear anywhere acne forms. The bacteria inside triggers the body's defense, making the bump sore. Don't squeeze papules, it only worsens inflammation and risks scarring. Look for red, raised bumps. Tender bumps without a whitehead. Spot treatments with benzoyl peroxide can help reduce bacteria and calm the area. Early care prevents papules from turning into more severe lesions. Hands off, let treatments do the work. That's how you keep papules in check. Pustules are the classic pimple most people picture. They start as papules, but as white blood cells fight bacteria, pus forms near the surface. This creates a red bump with a white or yellow center. Pustules can be tender and vary in size, often appearing on the face, back, or chest. The urge to pop them is strong, but doing so risks scarring and spreading infection. Instead, use a warm compress to help them drain naturally. Topical treatments and patience are your best tools. Look for red bumps with a visible whitehead. Treat gently for best results. Now, let's talk about nodules, severe, deep acne lesions. Nodules form when inflammation goes deep into the skin, creating large, hard, and painful lumps. They don't have a visible head and can last for weeks or months. Nodules are often red or purplish and much more painful than typical pimples. Squeezing is pointless and dangerous. It only increases pain and scarring risk. Nodular acne often appears on the face, back, or chest, and usually needs professional treatment. Over-the-counter products rarely work for nodules. Dermatologists can offer oral medications or injections to reduce inflammation and prevent scarring. If you notice deep, hard, painful lumps, seek medical help. Early intervention is key to preventing permanent scars. Don't try to handle nodules alone. Alright, let's move on to a more severe type of acne, cysts. We've discussed blackheads, whiteheads, papules, and pustules, but cysts represent a significant escalation in severity. Understanding what they are and how they differ from other types of acne is crucial for effective management. Cysts are, without a doubt, the most severe form of acne. They're not just a surface-level issue, they're deeply rooted and can have a significant impact on your skin's health and appearance. Recognizing them early is key to preventing long-term damage. Cysts are large, often painful, soft, fluid-filled lumps that develop beneath the skin's surface. They're more than just inflamed pimples. They're distinct structures with their own characteristics. Think of them as pockets of inflammation and infection trapped deep within the skin. These cysts reside deep under the skin, making them difficult to treat with topical solutions alone. Their location also contributes to the pain and inflammation associated with them. Because they're so deep, they often require more aggressive treatment strategies. Unlike the hard nodules we discussed earlier, cysts have a softer, more pliable texture due to their fluid content. Nodules are solid, firm bumps, while cysts are more like sacs filled with liquid. This difference in structure is important for diagnosis and treatment. They're filled with a cocktail of pus, bacteria, excess oil, and inflammatory byproducts. This combination creates a breeding ground for infection and further inflammation. The presence of bacteria is a key factor in the development and persistence of cysts. And of course, dead skin cells, which contribute to the blockage and inflammation within the cyst. This buildup of debris further exacerbates the problem and makes it harder for the body to clear the infection. All of this culminates in intense pain and swelling, making cysts not only unsightly but also incredibly uncomfortable. The inflammation can extend beyond the immediate area of the cyst, causing tenderness and throbbing sensations. Due to their size and depth, cystic acne carries the highest risk of permanent scarring. The inflammation damages the surrounding tissue, leading to collagen breakdown and the formation of scars. These scars can be disfiguring and emotionally distressing. Because of their severity, home remedies and over-the-counter products simply won't work on cysts. These treatments are designed for milder forms of acne and cannot penetrate deep enough to address the underlying inflammation and infection. Therefore, professional treatment from a dermatologist is absolutely essential to effectively manage and minimize the risk of scarring. A dermatologist can provide targeted therapies and interventions to address the root causes of cystic acne. Dermatologists may prescribe oral medications such as antibiotics or isotretinoin or hormonal therapies, particularly for women whose acne is linked to hormonal fluctuations. These prescription treatments are designed to target the underlying causes of inflammation and oil production to effectively manage cystic acne. A crucial point to remember: never ever try to drain a cyst at home. Attempting to pop or squeeze a cyst is incredibly dangerous and can significantly worsen scarring, spread infection, and cause even more inflammation. Cysts can appear not only on the face, but also on the chest, back, and even on the upper arms, making it a widespread and potentially debilitating condition. Ultimately, understanding your specific acne type, including whether or not you're dealing with cysts, helps you choose the right treatment approach and, most importantly, know when it's time to seek professional help from a dermatologist. Remember, non-inflammatory acne, like blackheads and whiteheads, can often be effectively managed at home with over-the-counter products and a consistent skincare routine. However, severe forms of acne, especially cysts, absolutely require a dermatologist's expertise and prescription-strength treatments. Knowledge is your best tool in the fight against acne, paving the way for healthier skin, improved self-esteem, and renewed confidence in your appearance. So take charge of your skin health, and trust me, your skin will thank you for it in the long run.